Chapter 15, Dental Caries. Dental caries, or tooth decay, is the most common chronic disease among children, teenagers, and adults over 65. Emphasis is now preventing future caries, not just dealing with already present decay. Bacterial infection. Two specific groups of bacteria found in the mouth are responsible for dental caries, MS and LB. They are found in relatively large numbers in dental plaque. The presence of LB in the mouth indicates a high sugar intake. Oral biofilm. Oral biofilm is a colorless, soft, sticky coating that adheres to teeth. Oral biofilm remains attached to the tooth despite movement of the tongue, water rinsing, water spray, and less than thorough brushing. Formation of oral biofilm on a tooth concentrates millions of organisms on that tooth. Enamel structure. Enamel is the most highly mineralized tissue in the body. It is stronger than bone. Enamel consists of microscopic crystals of hydroxyplate arranged in structural layers or rods known as a prism. The enamel crystals are surrounded by water. The water and protein components in the tooth are important because that is how the acids travel into the tooth and minerals travel out of the tooth structure dissolves. The caries process. For caries to develop, three factors must be present and at the same time: a susceptible tooth, a diet rich in fermentable carbohydrates, and specific bacteria. Pits and fissure caries occurs primarily on the occlusal surface and the buccal and lingual grooves of posterior teeth, as well in the lingual pits of maxillary incisors. Smooth surface caries occurs on intact enamel other than pits and fissures. Root surface caries occurs on any surface of the root. Secondary or recurrent caries occurs on a tooth surrounding a restoration. Caries is an active, ongoing process categorized by alternating periods of demineralization and remineralization. Stage 1, caries begins to demineralize the enamel, and stage 2, development of cavity or lesion. Secondary or recurrent caries form in the spaces between the teeth and the margins of a restoration. This is not easily seen, thus diagnosis is difficult. New restorative materials may prevent recurrent decay. Root caries occurs on the root of the teeth that have gingival recession that exposes the root surfaces. This becomes more prevalent and is a concern for members of the elderly population who have gingival recession exposing the root surfaces. Older people often take medication known to reduce saliva flow, which contributes to caries. ECC, an infectious disease that can happen in any family. Tooth decay is the single most prevalent disease of childhood. Risk factors include lower socioeconomic status, particular ethnic groups, limited access to dental care, and lack of water fluoridation. ECC is transmissible disease. Bacteria in the parent or caregiver's mouth are passed to the child. It's important for parents to keep their own teeth healthy and keep their children's teeth healthy. Baby bottle decay is another term for ECC. Physical protection involves a cleansing effect. Thick or viscous saliva is less effective than a more watery saliva in clearing carbohydrates. Chemical protection contains calcium, phosphate, and fluoride. Antibacterial substance in saliva work against the bacteria. If salivary function is reduced for any reason, the teeth are at an increased risk for decay. The following methods are used to detect dental caries, and each has specific limitations: the Explorer, radiographs, visual appearance, indicator dye, laser caries detector, and optical coherence tomography. Collecting data helps the dentist determine treatment protocol. A dental health professional assesses an individual's risk factors and protective factors, then determines the level of risk for caries. Not all patients are equally at risk. Caries management by risk assessment is an evidence-based strategy for preventative and reparative care for early dental caries and can be used in any dental office. American Dental Association Caries Classification System Categorize location, state of origin, extent of disease, activity level of carious lesions, and caries risk task.